my name is Rachal. I'm a quadruple-board-certified physician in adult and pediatric infectious disease and board-certified in internal medicine and pediatrics. I spend a lot of time with our internal medicine and pediatrics residents, as well as our fellows in both adult and pediatric infectious disease, preparing them for boards, and also a big part of their board review program. The recipe for success, which I'm going to quote one of my attendings, is that you need to know what you don't know. And that's the hardest thing to know whenever you're getting ready to take boards or study for a test. Because you know what you know, and you know what you think you might not know, or what you think you might struggle at the hardest, but it's that area kind of in the secrecy, if you will, that really is determined by the in-training exams that are done across multiple specialties, where they tell you what you don't know. And using the in-service training exams for your specialty are very, very important, at least when it comes to the written board exams, to have a list of areas that you need to focus on. And so a good board prep is trying to get on top of some of those weaker subjects throughout your training period, and then trying to set aside at least 6, if not 9 months to start on your harder subjects at the beginning and have time to review them at the end, with what I like to refer to as a potpourri or practice test at the end, or kind of really the high points. And time management is definitely key to doing well on your boards, not only from when you're actually physically in the exam rooms to making sure that you're able to go through questions pretty quickly and pick answers correctly pretty quickly, but also for preparation purposes. Blocking off time to schedule or study for your boards is very hard. In terms of dividing up time, we're supposed to give 80 hours a week during training to training. And so if you happen to be on a shorter rotation, where you have 40 hours a week that you're at work, and you have 40 hours a week of, I would say, off time, I would encourage you to use half of that off time towards studying, and the other half of that off time is towards doing something for yourself that makes you human and reminds you what life is outside of medicine. Ideally, you would be spending at least 10 hours a week on average throughout your training to devote toward your studying. But at a bare minimum, in the last 6 months, you're going to want to be spending about 40 hours a month looking over material. And that may need to be higher if you're somebody who has more subjects that you need to cover because you haven't been consistently covering things that were identified on the in-service training exams throughout your training. Looking and thinking about putting together a study schedule seems incredibly overwhelming, and it is very overwhelming. I think anytime that you sit down and you're like, oh my God, I gotta get through like all of this and all of this and all of this. If you just open a page and read a paragraph and do 10 questions, you'd be surprised at how many barriers that can break down for the I can't do this right now. Because after you did the 10 questions, you're like, man, I could do that. Well, let me do another 10 and read another paragraph. And you can kind of move on from there. I also am very big into the sandwich method of, if I really don't feel like studying, I choose a subject that I really like, but I limit myself to the number of questions I do in that subject. I do a topic that is a lot harder for me, and then I finish with a short thing of questions in something that I really like and I know I'm good at, and that builds confidence to actually go into the study session. Actual immediate consequences if you don't pass your boards. It kind of depends on which job role that you're in. So I am not in a surgical specialty, and obviously they have different parts and sets to their boards. Where they have, a written board and then they have oral boards following. I don't have that within any of my specialties. From a written board perspective, like I said, there is some leniency within jobs, but credentialing can be harder in certain states and under certain medical licensure committees and in certain hospital systems. They're going to want to see that you're not only board eligible, but board certified. I don't find that like I said, if you have more than, 2 2 attempts at your boards and then have difficulty, it will make it harder for you to credential in a hospital system. And again, within the primary care world, it's a little bit different, in which case, they may take somebody who is board eligible, but that board eligibility, at least in most specialties, is only for 5 to 7 years. And you're only allowed to attempt your boards 3 times within 3 years, and then you actually have to wait a year. And again, this is very different for a variety of different specialties, but it's more and even more important if you fail your oral boards in the surgery side. You may not actually be allowed to practice certain parts of your certification, which can be very difficult if you spent that long training and you didn't pass your oral boards. I really try and tell my residents, fellows, etc., who are sitting for their boards that when you do sit for your boards, you need to feel like you are prepared and that you will pass the boards, because there's a whole psychological component to not passing your boards. And it is better to tell your job that you are not ready to sit your boards, and that you would like some additional time to study for your boards than to not pass your boards and have it in your contract that you need to pass it in the first 6 months, etc. And so that might be something that you need to be looking for when you're applying for jobs. Most jobs give a leniency of about 1 to 2 years, but past that, some jobs won't allow you to practice in certain areas, and it really just kind of depends on your specialty. I will tell you that the "I'm going to fail" is not how you want to actually enter the test taking area, because there's a lot of things you can do as a test taker to psych yourself out. And that starts, even before you get into medical school. Like the steps were also very similar. I think the other bit that people can obviously get themselves into, I would say, to a psychological state, which, impedes them from actually doing well, is like, I'm never going to learn all of this. And I'm going to tell you, you probably know enough about it if you did your training and studied during your training course that you can recall some things. But you have to study and prepare. And so if you don't feel like you made the studying and preparedness, and I would say a lot of us in medicine are very much so type A personalities, and if it's not perfect, we don't want it that way. You're not going to be perfect at your boards. And that's not the goal, is for you to be perfect. The goal is for you to identify the areas that you need more and additional work in before you sit those boards, so that you feel more confident in those areas. And then you have other areas of confidence that are supposed to carry you through. If my friend or one of my residents or fellows was about to walk into their board exam, I would tell them the following: that you've been in this field for X amount of years, that you've studied hard for this test. What you know, and what you don't know, you don't know. But it's gonna be okay, and you're going to do as well as you anticipate that you're going to do. So don't psych yourself out. Get a good night's rest, do something good for yourself the night before, pack a good lunch, take a nice break in between, and you got this.